particularly from the perspective of the federal government, as well as from the Pinellas County medical community and from the small business community. Just to give you a preview of some of our special guests on the line with us, we have St. Petersburg Mayor Rick Kreisman, Clearwater Mayor Frank Hibbert. We have with us the Chief Medical Officer for BayCare Health, Dr. Nishant Anand. We have the owner of a local finance company named Leo Irizarry, who's here to answer questions related to small business loans. He's also joined by public affairs specialist with the Small Business Administration, Miss Cathy Cook. And finally, we're joined by Congressman Crist, Deputy Chief of Staff and Legislative Director, Mr. Chris Fisher, to get in the weeds a little bit about what the federal stimulus package has provided for the constituents of Pinellas County amid this crisis. So I want to once more remind everybody to press *3 if you have questions for our panelists or for Congressman Crist. We do have a whole lot of callers on the line and only have until 7:30 this evening, but I encourage each and every one of you to, if you have a question, hit *3. If we don't get to your question on today's call live, you'll be directed to leave a voicemail, and we'll be sure to get back to you with an answer as soon as we can. So *3 to ask a question. With that, I'd like to introduce the Congressman for Florida's 13th Congressional District, Congressman Charlie Crist. Sir.
Stephen, thank you very much, and I want to thank all of you for joining the call tonight. It's a privilege and a pleasure to have the honor of serving you, and particularly tonight to talk about the coronavirus and the steps that we're trying to take to get us through it. That's why we're holding tonight's call, and I understand that many people are frightened. It's important to hear your concerns, and I want to let you know that my office is here to serve you. And the goal of tonight's call is to provide the latest information from experts, to give you peace of mind. That's incredibly important. And our community and nationally are working diligently together for you and your families. As you know, Congress has passed 3 coronavirus aid packages providing a helping hand to working businesses and individuals. I know a lot of challenges remain with distributing the assistance, but let me assure you that help is on the way. The House is currently working on a 4th aid package, by the way. The last one, as you probably are aware, provided about $2.2 trillion. And as I said, we're working very hard with the administration, the Department of Treasury, to get these funds out to you as quickly as possible. We know how important it is and how much it is needed. I'm calling for a rock-solid economic and safety commitment to our frontline healthcare workers and other essential workers who are doing their part to save lives literally and help us stay home safely. I'm calling for borrower protections after hearing from many of you that your lenders are asking for a balloon payment on the top of the mortgage protection we work so hard to already secure, and that's wrong for them to do that. I'm asking for at least 2 more months of the $1,200 checks for individuals and closing the loophole so older children, college students, and dependent adults with disabilities can also get assistance. We've never faced an economic crisis like this. You all know that. It's not the American people's fault. We're in this situation, and you know that as well. And I want to make sure that you have enough money to take care of yourself, your family, and the needs that you have in addition to that. We're also pushing to expand the student loan debt relief until 6 months after the emergency ends, and expanding nutrition assistance so more people are eligible for more food and that people can afford to feed their families safely. I'm working to get you cash refunds for canceled flights. You and I have bailed out the airlines to a large extent, and you deserve to be treated better at this point. We need to double down on small businesses assisting and extend the loan forgiveness window through the end of the crisis. The last thing I'll mention is the free press. We need an independent media and our newspapers now more than ever. But they're hurting, and aid for them, I believe, is very important to protect the First Amendment, to make sure that we have honest journalism that is straightforward, truthful. I know my favorite newspaper, the Tampa Bay Times, can only print now twice a week on Wednesday and Sunday, which breaks my heart. And I think we need to do more so that we have that local reporting that so many of us depend on so much. On that note, I want to make sure that we have enough time for you to hear from our other panel members. As Stephen mentioned, we are blessed to be joined on this call by Mayor Rick Kreisman, a great man and a great mayor. Newly elected Mayor Frank Hibbert from Clearwater. In fact, he's back in the saddle. He's been there before, and congratulations to you, Mayor. Dr. Anand, the Chief Medical Officer for BayCare Health System. Leo Irizarry, Small Business Lending Expert. Cathy Cook from the Small Business Administration. And my Deputy Chief of Staff and Legislative Director, Crist Fisher. This call will be moderated by my District Director, Stephen Kerry, who you've already met on the call. Our panel is here to provide you with whatever information we can on your health and your financial safety. We all have an important role to play here in Pinellas County, and this is a special community. We're blessed to live where we live, and we are blessed to live in Florida. And these are challenging times, but I know we'll get through it. So I look forward to the panel speaking as we go forward, and I will turn it back over to Stephen at this time.
Thank you, sir. So I want to remind everybody again on the call, if you have a question you'd like to ask Congressman Crist or our panel, please hit *3 on your phone, *3 to ask a question and get added to the queue. So I'm going to move on to our next special guest. I'd like to introduce the Mayor of St. Petersburg, Mayor Rick Kreisman. Mayor Kreisman, would you mind saying a few words?
I'd love to. First off, thank you, Stephen and Austin, for helping to coordinate this and moderate it. Congressman Crist, obviously, kudos to you for doing this, and my thanks to you for fighting for us back home here during this crisis and trying to get us the resources that we need. I know you're in there every day advocating for the folks you represent back home, and we greatly appreciate it. And just a special hello to my old from long ago, Mayor Hibbert, who we haven't had a chance to see each other since you've been elected, but congratulations. So, first and foremost, news we to Sunday, taking up to 100.
Mayor Kreisman, your phone's breaking up a little bit. I'm afraid you may want to try to find a better connection.
Okay.
Perhaps if we're able to do that, we can. Mayor, are you there?
Yes, sir. Can you hear me now? Is that better?
Yes, that's much better. Thank you.
That's perfect, Mayor.
Okay.
Thank you.
Sorry about that. So quickly, just to reiterate, 24 new cases from Friday to Sunday in Pinellas and 8 new cases from Friday to Sunday here in St. Pete, taking us up to 124 cases. We continue to work on what we call our issues of compliance, which really are just trying to get folks to comply with the Safer at Home order that has been entered by Pinellas County and the governor. Tomorrow, during a live Facebook, I will be reiterating those orders and, in particular, focusing on how those orders relate to our parks. I think there's a lot of confusion about what is permitted and what isn't permitted, and we want to make sure that our community is safe. It's the only way that we're going to be able to successfully flatten the curve. The other thing that I really wanted to mention to the listeners right now is about our Fighting Chance Fund. If you're not familiar with that, the applications went live on Thursday. It is the City of St. Petersburg's way of trying to make sure that we preserve the character of our city, and you find the character of St. Petersburg in the small business community in St. Pete. Whether you're out on MLK, or you're on 22nd Street South, or you're on Central Avenue or Beach Drive, that's where you find the real heart and soul of St. Petersburg, and it's in our independently owned small local businesses. And so knowing that there was going to be a challenge to get federal funding and state funding quickly into the hands of people, the City of St. Petersburg has stepped up, and we are going to be putting about $6.8 million on the streets for our small businesses, $5,000 in grants to each small business that is either a bar, a restaurant, a retail business, or personal services business. These are the ones that have been impacted the first and quickest and most deeply here in St. Petersburg. The only requirement of those businesses is that they're at least 50% locally owned and independent, that they have 25 or less employees, and that they've been in business for a year. So you can go onto the St. Petersburg website, stpete.org/Fighting Chance Fund. You can go on and fill out an application. We've had over 757 businesses that have already done so. We are working to process those, get them reviewed, and hopefully get the funding out quickly. We've had over 1,081 individuals, people who work in those businesses who have lost their jobs or have seen their income reduced by 50% or more. Over 1,000 individuals have applied for this funding. We're providing $500 to each individual as part of our first phase of this program. And again, that application is at stpete.org/Fighting Chance Fund. It is not a loan. It is a grant that does not have to be paid back to the city of St. Petersburg. And our hope is that this helps folks get by for at least 30 days until either the federal dollars are able to be tapped into or the state dollars by those businesses and individuals. And also, again, tomorrow during that live Facebook, we will be talking about a second phase of the Fighting Chance Fund. So I want to encourage you to tune in. That'll be somewhere between 3 and 3:30 tomorrow. Last thing I'll mention, and then I'll step aside if there's any questions, and again, appreciate the opportunity to get on this call, is you can go online if you are someone who is trying to figure out, how do I get involved? How do I help our business community? How can I make a difference in the community? Jeff Vinnick and his wife, Jeff and Penny Vinnick, have stepped up. They've contributed $100,000 to our Fighting Chance Fund. The Milky Foundation, Family Foundation, has also contributed $100,000. And we want to keep trying to build that fund up so that we have more dollars that we can put on the streets to help our local businesses and the employees of those businesses. So again, you can find all that information at stpete.org/Fighting Chance Fund. Congressman, again, I appreciate the opportunity to be on this call for a little while. I'm going to have to jump off at 7, but I'm happy to try and answer any questions anyone might have for me. And just want to tell everybody, just hang in there. If we all are safer at home, we can flatten this curve and get on the other side of this thing.
Great, Mayor. Thank you so much. Really appreciate you being on the call, and thanks so much as well for your leadership. And now I think I'd like to turn it over to Mayor Frank Hibbert of the city of Clearwater.
Thank you, Congressman Crist. It's great for you to reach out to all of our neighbors. I look forward to working with you again, and obviously Mayor Kreisman, we have a long history, and I appreciate his leadership. This really is a time for thanks, but it is also a time for caution. I think we are all an independent people, but I hope everybody takes distancing very seriously, as though you were worried about your grandkids. We see people that are starting to bend the rules already, and I think they're getting some cabin fever, which I think we all have. But I am just urging people to wait it out for at least the next several weeks until we do see that curve flattening. It's also a time to thank our medical staff and first responders and all those people on the front lines. I don't think we thought that would be the case for clerks and personnel at groceries and pharmacies and the like, but they've done a magnificent job for us. I would also ask everyone to be patient with your neighbors. Stress really manifests itself in a number of different ways, and people right now, even if they aren't showing it, are stressed. Financially, with health, with family concerns. So I've just kind of tried to take an extra moment and talk to people on the phone and just give them another helping of patience, which I'm not always great with. I also talk to a lot of parents who are very appreciative now of our teachers because they didn't know what a tough job that was, but they've learned over the last several weeks, and they want to give their kids back to those teachers to be doing all the teaching. As Mayor Kreisman said, there's other ways that you can help. I would encourage you to turn to your local charities if you have the financial resources through the Salvation Army, the YMCA, United Way. They are all doing a lot of good in the community right now, a lot of feeding going on through Feeding Tampa Bay, and we thank all of those folks. Sometimes in my city, and I think in most, we have a push and pull between neighborhoods, the business community, and tourism. But right now, we are all in this boat together. And in Clearwater, we are preparing for a recovery task force in conjunction with our chamber. We're finding ways that we are going to give grants to businesses, reduce some of the red tape through City Hall, and get employers, when we get on the other side of this curve, back into business so they can get to the work of employing people. And I am still very hopeful. This will be a time, hopefully, that good things come out of this crisis. But we are going to get through this. We will get through it together, and we will be stronger. I hope we come together as a nation and as a Tampa Bay region after this. And with meetings like this and Congressman Crist and Mayor Kreisman and all the rest of us pulling in the same direction, we will be able to do that. So God bless you all.
Mayor, thank you so much. I appreciate your words of wisdom and encouragement and your leadership as well. At this time, I'd like to turn it over to the Chief Medical Officer for BayCare Health System, Dr. Anand. Dr. Anand, thank you for being with us this evening.
Thank you, Congressman Crist. I appreciate the invitation to join you and our other leaders today to talk with our Pinellas County residents regarding some of our collective efforts. After several weeks, I can say that I feel cautiously optimistic with some of the progress that's been made and the direction we're headed. It's been a fantastic partnership between the city, the county, the state, our federal elected officials to help position Pinellas County and our region in a position to deal with this crisis. Two things I'd like to point out as encouragement and words of optimism. One, most people who do get the COVID virus, which is the disease caused by coronavirus, are getting better. In fact, 85% of the people who end up getting the coronavirus actually end up never ever needing to even be in the hospital. And so we're seeing some great results. Two, and I think this was alluded to by some of the previous speakers, we are seeing flattening of the curve. In fact, I'm very cautiously optimistic that we can handle what's expected to be the current surge that we're anticipating to happen. Right now, that surge is predicted to happen on May 3rd based on some models that we have seen from the University of Washington. Social distancing is working, and as a physician, especially as an emergency medicine physician with some experience in disaster medicine and infectious disease, social distancing is working. It's not easy. It's not painful. I'm a parent of 3 kids who are very active, playing soccer all the time, and it's been an adjustment, but it is saving lives. And so I implore the folks on this call to continue to practice social distancing, avoiding those crowds. If every individual who gets infected stays home and does not infect other individuals, we're actually going to be able to conquer this virus. There were some numbers that were given for Pinellas County. I was looking last night. There were 451 cases of individuals that were infected and roughly 13 deaths. That's 47 people for every 100,000 individuals who have been infected. That's about 1/5 of what's happening in Miami-Dade County. And so when we talk about social distancing, the strong leadership in this region, I do believe is starting to really help make a difference for us. Testing, there's been a lot of press about testing and what a difference 2 months makes. When we first started this fight against the COVID disease, we were very limited in our testing abilities. Now we have the County of Pinellas offering testing sites, all the large healthcare systems, including BayCare. We are offering drive-through testing sites as well as testing in our emergency departments and our hospitals. If anyone needs to get tested, I always recommend first reach out to your primary care physician. If not, we have a nurse triage line, 1-800-BayCare. That people can reach out or show up at a drive-through. And the testing is actually pretty improved dramatically. There's rapid testing, and we've launched one of the rapid tests that can get your results back in about 5 minutes for our patients who are admitted to our hospital, which is a game changer and really helping improve lives. There's been a lot of mention of the turnaround times for getting your results, and we apologize. I know we were working with some commercial labs, Quest and LabCorp. The results were taking about 10 to 14 days, and now today, due to some great work by those companies, the results are coming back in 3 to 4 days. So again, if we run the test within our facilities, we can get results within an hour, 5 minutes up to an hour. If we send them out, we can still get them back pretty quickly. We have a lot of focus, and you'll hear a lot more about this in the media, but the next area to focus on with testing is antibody testing. We believe that there are individuals who have been infected with the COVID disease that are likely immune, and so as we become able to acquire that test and test for the antibodies, we're going to be able to identify which individuals are able to build up immunity and which ones are going to be safe as they enter society. Briefly, there's some treatments that we've had great promise with. So for roughly about 5% of individuals who develop the coronavirus or the COVID disease actually end up in the ICU. And we've had some dramatic improvement with some of the medications that are out there. One of them called Hibbert, which has been very successful. My take-home messages that I want to leave you with is the next 2 to 3 weeks are going to be extremely important. And I just can't emphasize just with my colleagues the importance of social distancing. It is going to be time well served to stay at home, avoid spreading this disease, because if we don't, it's going to be measured in lives, not in the time that we save. The peak is again expected roughly May 3rd. It's a moving target. It's very much, I described it as hurricane projections, and it changes time to time. But it is looking like it's a much flatter curve, and I believe our healthcare systems right now can handle some of the ICU need that's going to be out there, which again will translate into lives being saved. There will likely be recurrences. Even if we make it through this period in May, there are going to be likely some recurrences. And so we as the healthcare systems in the area, we stand ready to help you. And if there is another recurrence, we'll react quickly. The most important thing is we are in a much better position than we were about a month ago or 2 months ago, where we have better testing. We have personal protective equipment. Our facilities and our resources in the medical community are in much better shape. And so I want to end by thanking Congressman Crist and our other elected officials and governmental officials with some of the tough decisions that have had to be made. They've helped us from BayCare perspective in acquiring the personal protective equipment that we needed to safeguard our physicians and our team members. They've helped us get the testing that we need so we could provide it for the community. We are in a much better shape, and I think together we are going to be able to deal with this coronavirus successfully, and we will save lives. So thank you, Congressman Crist.
Thank you, Dr. Anand, and thank you for sharing your God-given talent with us and your expertise. It's awfully important and very informative. Next, we'll hear from a small business lending expert, Leo Izzarari. Leo, thank you so much for being on the call with us this evening, and love to hear what you have to say to help us out.
Congressman Crist, I appreciate being on the call and invited on. You said it so well in the beginning of the call, and I agree with it completely. My goal would be to provide the small business owners in the Tampa Bay area some peace of mind. The application process for the two main loans that we'll be talking about, the PPP loan and the EIDL loans, has been a fluid process, we can say, as some of the requirements were changing daily last week regarding the PPP loans. I'd really want to stress to the listeners of this call to be patient. The majority of banks are waiting on clarity from the Treasury on how they are going to be reimbursed for the PPP loans. Right now, the banks are having to put up their own collateral for the loans, so that is what's causing the delay in the PPP loans. The good news and the light at the end of the tunnel is that I'm hearing reports of some of the EIDL loans, or the Economic Injury Disaster loans, being processed, and a lot of those include that $10,000 advance grant to small businesses. Now, I'm hearing reports that not everybody is getting the full $10,000. Some businesses are getting, $1,000. Some businesses are getting $2,000. But a good majority of businesses I'm hearing are getting that $10,000 grant along with approval of the loan along with that EIDL loan. So that's good news that I'm hearing on the front line with business owners.
Great. Thank you so much. I really appreciate that. At this time, we have the privilege, frankly, to be able to hear from Cathy Cook. She is with the Small Business Administration. Obviously, Cathy, that's a key component to all our recovery, particularly economic, evidently. And we look forward to hearing what you have to say. And thank you so much for being on our call this evening.
Yeah, thank you for inviting me. The Economic Injury Disaster Loan, the EIDL as we call it, is meant to keep the business in business. These are working capital loans, and they're for all the fixed debt and payroll, accounts payable, and other bills that could have been paid had the disaster not occurred. The loans are up to $2 million. The interest rate is 2.75% for nonprofits and 3.75% for-profit small businesses. Small businesses, agricultural cooperatives, aquaculture businesses, and nonprofits are eligible to apply. And recently, SBA extended the nonprofits to make allowable religious organizations. That means that now churches can apply for economic injury disaster loans. The process is relatively simple. We have a streamlined application that asks simple questions regarding the gross revenues, cost of goods sold, number of employees, name of the business, simple questions such as that. And then at the end of the application, we ask if you're interested in the up to $10,000 economic injury disaster loan advance. If you check that, you would be eligible for up to $10,000 in an advance of the economic injury disaster loan for the fixed debts and payables and other bills. And that amount is based on the number of employees. So if you have 10 employees, then you would be eligible for the entire $10,000, and it's a forgivable loan. If you only have one employee, then you're only eligible for $1,000. So that's where some of the confusion has occurred. People tend to say, oh, you can apply for the $10,000 loan, and you can, but it's based on the number of employees. Now, many people on this line might be thinking, well, how the heck can I pay a loan when I don't even have my business in operation? I'm staying at home. I don't have a grocery store. Things are bad and desperate. The administrator for SBA has made the first payment due for these loans 1 year from the note date. So that means even if I could approve you for a loan today, you would not make your first payment until April 13th, 2021. Our hope is to get the coronavirus under control, get businesses back in operation, and have them up to pre-disaster conditions before they start to have to repay. And I think that kind of gives you most of the nuances of my program. So I'll turn it back over to you, and thank you for the opportunity again.
Thank you so much, Cathy. Great to hear that information from you. It's extremely helpful and very important. And now to the listeners, my Deputy Chief of Staff and Legislative Director, Chris Fisher, will give us sort of some background and highlights of what the legislation that we have passed deals with. And let me tell you about Chris. He's an incredibly intelligent man, great heart, great passion, and great dedication. And can't thank you enough, Chris, for your service to the people of the 13th District of Florida. God bless you.
Well, it's my pleasure, Governor, and thank you for always reminding the staff who's the boss, and that's the constituents. As Governor mentioned in the opening remarks, the theme of the CARES Act, the big stimulus that you've heard about, is help is on the way. It includes the law includes the $1,200 stimulus payments, $400 for children 16 and under, $500 for children 16 and under. It includes 150 days eviction prevention if your landlord has a federally assisted mortgage. So that's Fannie Mae, Freddie Mac, USDA, VA, FHA. 60 days moratorium on foreclosures if you were in foreclosure, trying to keep you in your house if you were going through the proceedings. A penalty-free 6-month forbearance for homeowners who are struggling. That's you get 180 days plus another 180 days if you're financially impacted and having financial difficulty because of the coronavirus. Again, these are for federally assisted mortgages only, but the good news is that's at least 90% of the mortgage market. Governor has had the staff hard at work trying to get the help into the hands of people who are hurting. For an example, he fought very hard for the $600 a week. That's $15 an hour. Federal addition to the state of Florida's $275 a week maximum benefit. So for almost all working Floridians, that's a benefit of $875 a week. And that's great. That's very, very helpful for people who lost their jobs through no fault of their own. But then, as folks on the line are painfully aware, the website wasn't working. And then we saw the shocking images coming out of Hialeah with desperate folks just lined up, not social distancing, because they're so desperate to get even a paper application. So Governor Crist called on the state of Florida to develop an app for your smartphone. It should be simple. It should be easy to use. You should work with some of the best tech minds in the country. They're still at home. They're still working. And you, the people, should be able to apply for the benefits that you have earned and you have paid for from the safety of your own home. Governor's also fighting for the mayors on the call, Mayors Kreisman and Hibbert, along with Largo and Pinellas Park, because our mid-sized cities like Clearwater and St. Pete were left out of the direct federal relief for states and localities. And he has said to House leadership, and he said publicly, that we need to get the relief directly at the local level. Mayor Hibbert knows what Clearwater needs. Mayor Kreisman knows what St. Pete needs a lot better than, the Department of Treasury would. So we're hoping that that's in the next relief package as well. So the fight goes on to make the CARES Act work better for you, and in the next package to continue to do better for the people. And happy to answer any questions that I can work on.
Great, Chris. Thank you so much. Really appreciate that information. It's incredibly helpful, and thanks for all your hard work. And let me just let the listeners know on the call how blessed I feel to be able to work with the people that are on our staff in this congressional office. They're all very hardworking. They're all very bright. And I think it was John F. Kennedy who said, surround yourself with the best and the brightest. And I have been very fortunate to be able to do that. And with that, I want to turn it back over to our District Director, Stephen Kerry. If you can moderate us, Stephen, and thank you for what you're doing through the next questions. Please, sir.
Absolutely. Thank you, sir. And with that, we will go ahead and start to take some calls. So let's get right into it. First question is from Dolores. Dolores, you're live. Dolores, are you there?
Oh, yes. My question is the virus being spread through the air, or what do you think?
Can you repeat that one more time?
The virus, is it being spread by the air we breathe outside, or what do you think?
Hey, Dolores, this is Charlie Crist. Yeah, my understanding is that it's airborne. I think there were some original discussion that people weren't certain whether or not it was through bodily fluids or exactly how it was being transmitted. And I'm sure we're going to learn more about that as time goes on. Dr. Anand, I'm not sure if you're still on the call, but if you are, clearly you're the expert to address that. And if you wouldn't mind weighing in, that'd be great.
Sure. Dolores, thank you for your question. And Congressman, great explanation. So the virus does spread by contacts and droplets. So as people breathe into the air, it can spread. It's usually limited. We believe that it can spread about 6 feet. So it's not like it will just get into the air and be able to circulate openly and freely. So it is a proximity-based virus, and it's based on a lot of it is the droplets that get pushed into the air. So again, that's where that social distancing comes into play, because if you're outside of that window, 6 feet roughly is our understanding right now, you'll be safe.
Wonderful. Thank you for that question and for that answer. Next, we're going to go to John in St. Petersburg. John, you are live.
Well, let me just thank Congressman Crist for all the effort and your team that you do in governing and legislating for us, and having such a teleconference like you're providing for us. We really appreciate it. So
My pleasure,
small
John. Thank you.
So thank you very much. As a small business man, I applied for the Paycheck Protection Plan. I got it in as early as I could. I finished the application at my bank on last Tuesday, April 7th, and I've been kind of concerned because my CPA is telling me that they've already actually, she was telling me on the day I was applying that they've already ran out of money. I don't know where she got that information, but my concern is, have they run out of money, and will there be another appropriation, or is there some kind of holdup possibly that to keep that from happening?
Well, John, that's a great question, and I can assure you, as this thing moves along, in fact, Chris Fisher taught me this expression, that it's as though we're building the plane as we're flying it, and what that means basically is that we learn more every single day about the needs of our individual constituents, people like you, John, that I have the privilege to work for. You're the boss, and so we need to look out for your best interest first and foremost, and that's what we're trying to do in my office. And so as we go along, we're already working on a fourth stimulus package, and I'm sure it will continue to only expand. I was on a conference call today with my caucus, with Speaker Pelosi, and the topic of discussion was largely about what we need to do to expand these benefits, get them out more rapidly to people, the sooner the better, so that you don't get caught in this pinch. And so that's going to continue to occur. But let me also ask Chris to elaborate on more that you may be aware of in greater detail. Chris, please.
Sure, Gov. And John, thank you for the question. That's a great question. The CARES Act, the $349 billion in the PPP, that was really a down payment. And I will leave it to our SBA representative to confirm that no, it is not out of money. And what the speaker has said is that we absolutely need to make sure that small businesses have all the resources that they need. And we need to make sure that the hospitals have all the resources that they need. And we need to make sure that our cities and states have all the resources that they need. And, you know, we need to do all of the work, not just play partisan games on this one.
Okay, thanks very much for that question. Next, we're going to go to Nellie. Nellie, are you on the line? You're live.
Yes, I am.
Okay, go right ahead.
Congressman Crist.
Hi, Nellie. How are you?
Okay.
Good.
I'd like to know about the nursing homes and stuff. We can't get in to see our paper or nothing, and it is really hard right now with
Yes,
this
ma'am.
COVID-19 for everyone, I know. But, you know, you wonder and you worry about your loved ones that's in there. Are they being treated right and whatnot?
Well, nothing could be more important, Nellie, and I really appreciate your question and your focus on nursing homes and how they're treating our loved ones and our friends.
Yes.
You know, my impression from what I've heard so far, Nellie, is I think they're trying to do the very best that they can. Nobody's perfect, we know that, and we've heard about incidents of problems in nursing homes previously in Florida, and I'm cognizant of it. You know, we've had situations where that's been a challenge, frankly. But with that, and I don't know exactly how much knowledge you would have, Doctor, probably more so on in the case of hospitals and nursing homes, but I'll throw it to you for whatever you might be able to provide, sir.
Sure. Yeah, great question. And again, my apologies. I know this is a very tough time, especially not being able to see loved ones. I would say that from a BayCare perspective, we've reached out to several of the skilled nursing facilities in the area to offer our help and support in any which way we can. The reason that individuals are not allowed to visit at this time or have been restricted is to protect and safeguard the well-being of the residents that are there. it's an extremely vulnerable population, and some of the folks that can get extremely sick. So I think it is a very difficult time, but the skilled nursing facilities, we've been in contact with several of our partners in the community, and we know they're doing a great job in preparing. But it is for the safety and the well-being of the residents that reside at the skilled nursing facility.
Great. Thank you, Doctor.
Thank you very much for that. Next, we're going to go to Susan from Clearwater. Susan, you're live.
Hi. Thank you for taking my call today. Congressman Crist, you are the only one who has reached out, and I'm very grateful. It's
my pleasure. It's our job. Thank you, Susan.
Well, thank you very much. I have been unemployed. I'm a server. I've been unemployed since March 18th. I got into the unemployment system, but my application or whatever is stuck. It says pending and $0, and I've got nothing. And it would be nice. It sounds good to get $600 extra a week, and it sounds good to get $275 more dollars. But I'm getting $0, and I just bought a house this year, thank you God. But I'm scared to death that my bank account is going to drain out, and I'm paying my bills, but I'm scared.
Well, God bless you, Susan. But listen, don't be afraid, okay? You don't need to be. And let me give you some reassurance, and then I want Chris to follow up on it in greater detail. But as it goes to the $275 that the state of Florida pays unemployed per week, you're right, that's insufficient. It's not enough, and that's why we push for an additional $600 per week on top of that $275 that will be coming soon. And I think it's important for you to know that, and I think we'll only increase it going forward. So, and I understand your concern about, and congratulations, God bless you, on being able to buy a home. That's a wonderful accomplishment and not an easy task, no matter what you do for a living. And by the way, I used to serve people when I was in law school in Birmingham, Alabama. So I can relate to what you're doing, and it's a very important service you're providing. So thank you for doing that. In addition, I think it's important to know that last week, Representative Cathy Cook and myself, she represents Tampa and other parts of Hillsborough County. I represent most of Pinellas County. We had a joint virtual press conference via telephone also because of the distancing issues about encouraging the governor to increase the $275 per week for citizens that have found themselves unemployed through no fault of their own. And having been governor myself, I know that during a state of emergency, the governor has the right to expand upon those amounts unilaterally. And, people can challenge it in court if they want to, but God forbid somebody would do that during this circumstance when people need help the most, as you do. And so, Chris, if you could follow up, I think mortgages cannot be foreclosed on. People cannot be evicted. You don't really have to fear for that. But Chris, I hope that you can inform us a little bit more on that point for Susan's benefit.
Excuse me for 1 second. I am stuck in the system. I'm getting $0, and I can't get a hold of a live person. I call 50 times a day. And that is concerned.
I understand. You have a live person right now. And what we're telling you, and I hope Chris will back it up, is how much we're looking out for you because you deserve it.
Thank you.
You're quite welcome.
Susan, the governor's absolutely right on this. The $875 a week is a key benefit, and at least from the federal government, the $600 per week from the federal government, it is the law of the land that is retroactive to the date that you first became unemployed. And the governor of Florida, Governor DeSantis, does have the power to make the state benefit retroactive to that date as well. I know that's cold comfort for, you said you haven't had a table since March 18th. Often those in the service industry are living not even paycheck to paycheck, sometimes just day to day. You can't have a slow shift, or that'll put you in a strain. I will follow up with you tomorrow. I took your number down. I took your information down. I'll give you a call tomorrow to walk you through the process of putting your mortgage into penalty-free forbearance. 6 months, no additional interest, no negative information on your credit report, because the honest truth is we don't know when the state of Florida will get the unemployment application process up and going. And so that's why the CARES Act layers on the relief. So it's not just the unemployment benefit. It's the $1,200 stimulus checks that started going out last week. It's the penalty-free forbearance. You will not have to make a payment on your mortgage for 6 months, and it will come at no cost to you. But I'm more than happy to follow up tomorrow to help her walk through the additional benefits that are available.
Great, Chris. Thank you so much. And Susan, I hope that gives you some peace of mind. Stephen? Stephen?
My apologies, sir. Next, we're going to Consuelo. Consuelo, you're live.
Thank you, and I appreciate each and every one of you for all that you are doing for us. I will be calling in tomorrow because one of my questions was the last of the young ladies, so it's good to know what process and steps it'll take. But another question that I did have was for business interruption insurance. We pay for this business insurance if in our business if something was to happen, a disaster or anything. And today I found out that the COVID-19 is not considered a national disaster. So having this insurance and paying into this insurance, we're not qualified or the benefits is not available to us because it's not a fire or flood. So I had a question pertaining to that. And then the other one was for the fact of my banking institution that I have and I'm a part of that I do business with is not under the SBA. So for all the things that I signed up for and assisting my business at this time, I'm told it's not qualified. So being in business over 20-something years in the community, providing jobs for people, it's kind of hard to know that this situation can cause you to shut down.
Consuelo, thank you very much for those questions, and they are deeply concerning to me. And I have to ask you, you talked about the business interruption insurance. Is that a private insurance policy that you have with a company in Florida?
Sir, Consuelo has dropped off the line. She's listening in, though.
Okay. Well, if that's the case, that's an issue with insurance companies, and I'm not a big fan of insurance companies, and maybe a lot of people on the call are aware of things I've done as Attorney General and as Governor concerning that, but that sounds absurd that they would not consider what we're going through a national disaster. It is one of the most intense national disasters we've ever faced. So I think it would be important, Chris, if you can follow up with Consuelo tomorrow as well on this point. That would be very important. And I guess I would have to defer to Cathy Cook with SBA as to what lending institutions, if any, would not be covered by the Small Business Administration, so you can enlighten Consuelo and maybe give her some good guidance for the future.
Prior to the COVID situation, there were certain lenders that went through a process with SBA to be called a preferred lender, and they are the ones that process the applications. And on this particular disaster, they're the ones that work for the Paycheck Protection Program. SBA has offered any lenders who want to come under the fold to participate in offering the coronavirus loans, including credit unions. So we're expanding that, but it's taking time, and not all lenders want to go through the process of trying to learn how to make the loans and offer the loans. So I would say the best thing is to go on SBA's website, and certainly Mr. Rosieri can answer this too. Go on SBA's website, and there's a list of lenders And so you might not have to go through the one that you've been working with for 20 years. You may go to another lender and fill out the application. And also, there's always the economic injury disaster loan. Those are direct from the U.S. government. So you apply directly to SBA, and the funds are dispersed from the U.S. Treasury. So you don't work through a bank at all. And I would encourage you to apply for that. And you can get to our website, sba.gov, and you go /disaster, and that will take you to how to apply for the coronavirus. Thank you.
Thank you so much for that question. Next, we're going to go to Jacob. Jacob,
hey, Stephen.
Oh, yes,
Stephen,
sir.
I'm sorry. Forgive me. I think Cathy gave us good counsel there to pitch it to Leo. And so, Leo, if you could do that before our next question and give some additional counsel, that'd be wonderful.
Sure. Consuelo, that was a great question, and Cathy, that was great information. To simplify it as much as possible for everybody that's listening, with the PPP loan, you have to go through a bank. With the EIDL loan, it is direct through the SBA. So, Consuelo, the best thing that you could do for your situation, since your bank is giving you a hard time, is go to sba.gov, click on the banner at the top that says Coronavirus or COVID-19 Assistance, and click on the EIDL loan. The applicant, I've helped hundreds of my clients go through it. The application takes 5 minutes tops, and it'll get you in the queue for the loan and the advance.
Great. Thank you very much, Leo. Appreciate that. Stephen, you said you have another question, please.
Yes, sir. We have time for a couple more questions. I just want to note for folks that if we don't get to your question, you can leave us a voicemail and we will get back to you. You can also check our website at crist.house.gov. There is a whole bunch of information about resources out there for you related to these topics. Next, we're going to go to Jacob. Jacob, you're live.
Thank you very much. And I just want to start off by saying thank you to everybody who is helping, and all the doctors and everybody out there who's, really taking this fight to the front door. But my question was, has there been any patterns or finding out on who's more susceptible to this disease and being deceased from this disease?
Great question, Jacob. Doctor, can you enlighten us on that?
Yep. Yeah, Jacob, great question. So what we're finding are two things. Most people are equally susceptible to get the virus, but children are doing remarkably well. They may not even know that they're having symptoms. The individuals that we're most worried about are individuals who are over the age of 70 in particular, and especially if they have a chronic disease, which would include high blood pressure, diabetes, in some cases asthma as well. And so for those individuals that fall into that high-risk category, what we're recommending is to take extreme precautions. If you go out, make sure you wear a mask. Make sure you wash your hands very frequently. And if someone's sick around you, make sure that you absolutely are keeping as far a distance as you can. And those are the folks that we are really laser-focused on protecting in our community.
Thank you so much for that question. I think we have time for one more. Now we're going to go to Rose. Rose, you're live.
Yes. Good evening.
Good evening, Rose. How are you?
I'm doing fine, thank you. My question is concerning the $1,200 check that we're supposed to get, and my Social Security check goes directly into my bank account. I have not filed taxes, so I haven't filed a 1090 or anything. I haven't filed taxes in years. And what I need to know is, do I need to do anything else besides the fact that my Social Security check is direct deposited? Will they have that information, or do I need to go to a portal and fill out more information concerning my bank information and et cetera, et cetera?
Great, Rose. Listen, thank you so much for that question. And let me give you some reassurance. Because you're already getting direct deposit, you will get direct deposit of the $1,200 checks as well. I want to make sure that I confirm that with Chris. But Chris, if you can speak to that a little more extensive, that'd be great. Thank you.
You are right, Governor. Rose, the checks, they're trying to get the checks out for Social Security recipients next week, but if you're already on file with Social Security for your direct deposit, you should be good. This would cover 99% of all Social Security beneficiaries, and that was actually one of the things that Governor Crist was fighting for. Initially, the IRS said that you would need to, so I'm not surprised that there's some confusion out there. But he made it very clear to the IRS that, no, you're not going to ask senior citizens to fill out a tax return that the IRS hasn't even written yet and further delay the aid to seniors who truly need it. Fortunately, he was successful on that. IRS changed course, and those checks should start going out next week into direct deposit.
Great. Thank you, Chris.
Wonderful. Thanks so much. Well, that's about the time that we have for this call. We thank everybody for joining us. If you do have a question, we do encourage you to go ahead and press *3. You'll be directed to leave a message, and our staff will be happy to get back to you with the most complete information that we can. Thank you again for joining us. I'm gonna say thanks to all of our panelists and guests, and turn it back one more time to Congressman Charlie Crist.
Great. Stephen, thank you. And again, to all of our panelists, I can't thank you enough for being on. It's invaluable information that you provided to so many listeners. I'm told about 12,000 again tonight, which we had several days ago when we did this the first go round. But you all out there should know that this is an important and critical time in our nation's history. It's a wonderful time to remind ourselves of the power of God and how important it is that we keep the faith and go the distance. There's a wristband that I wear all the time, a yellow wristband that says, "Practice the golden rule every day." And of course, you know probably that the golden rule means to do unto others as you would have done unto you. And we're in a situation, I think, now like never before. And what I'm so proud of, I'm an optimist, and what I'm so proud of is our fellow Americans and how they're reaching out to help each other. Physicians like you, doctor, people in the financial industry, Leo and Cathy, you with the SBA, and all of you on the call, all of you that are listening and asking incredibly important questions. With God's grace, we will get through this. As I said, I'm an optimist, and I know that we will. We're Americans. And nobody is, I think, better suited to get through this thing than America. After all, we're the richest country in the world. Frankly, we're the richest country in the history of the world, and the strongest country in the history of the world. It's not all about money, after all. I mean, I know resources are incredibly important, but, it's mind, body, and soul. And, in a situation like this, we have to be guided by the better angels among us. And that's exactly what's happening in the United States. I pray for all of our leadership, and I pray most importantly for all of you. So God bless you, and thank you for joining us tonight, and Godspeed.